What is this?
Don't worry about that.
Oh, okay.
Some student wrote that.
Okay. Come in.
Hey, Alan.
Steve.
Nice to meet you. Mind if I take a seat?
Oh, no problem.
All right. So I read that you're a graduate of the UCF medical program.
Yes, sir.
I actually graduated from UCF myself too.
Oh, cool. What year?
But actually 4 years ago in 2008. So,
Nice.
yep. So I've been with GlaxoSmithKline ever since.
Okay.
So, before I continue, does anybody else need to be present?
No, I'm the main doc here.
Okay, great. Well, let me introduce myself a little bit. As I said, I graduated from UCF in the marketing program,
Mhm.
and I've been with GSK ever since. And recently, I've been working solely with substance abuse clinics like yourself. A little bit about the company. We are the second largest pharmacy firm in the world, and one of our biggest brands is actually the Nicorette gum and patch. Together, they're one of the world's top 10 over-the-counter brands. So it's something
That's
we're
good to
very
hear.
proud of. I'm going to ask you a couple questions
Sure.
to better identify some of your needs. How is the current success rate of the patients involved in your program?
We're actually really proud of our success rate. It's around 40%. We prefer to use non-drug approaches, so
Okay.
because we have an intensive psychological counseling sessions in like a
Okay.
12-step program that we use for members addicted to nicotine.
Okay, that's very understandable. A lot of, people are trying to get off drugs. You don't want to put them on another one. And,
Yeah, and I've heard of GlaxoSmithKline, and I've heard good things about them.
yeah. We're actually, Nicorette is one of our biggest products. It's something we take a lot of pride in. So we like helping people break the nicotine addiction.
Okay, and I've actually heard that you can become addicted to Nicorette itself since it contains nicotine, and that really worries me.
Well, I'm glad you asked that because Unity Clinic, I'm not sure if you heard of them, they're another
Mhm.
substance abuse program.
Yep.
They actually had the same problem, but we have a testimonial from one of their doctors.
Right.
They found that patients liked the gum because not only did it help them with their impulsive, kind of impulsive wanted cravings for a cigarette. It also decreases your Nicorette, the amount in the gum as you go through the 12-step program. So you're getting less Nicorette or nicotine in the gum as you go along. So by the end of the treatment, you're actually completely nicotine free.
Okay, so there's no chance of
Right,
being
right,
addicted to it.
right.
Oh, that's great. Okay.
What have you tried in the past to improve the success of your program besides offering nicotine products?
Oh, we've just fine-tuned it over the years. Just strictly non-drug approaches, psychological counseling. So
Okay.
we've just based
So
it off.
you've never tried to offer nicotine products to your patients before?
No, I
Okay.
haven't. And I'm actually worried about how it tastes because I don't think patients would like to chew something that's tastes really bad.
I'm glad you brought that up. I have another testimonial from another substance abuse clinic. Dr. Smith actually started offering the gum to his patients.
Mhm.
And a lot of his patients actually said, the Nicorette gum tasted a lot better than their first cigarette.
Oh, that's
and
great.
some numbers here will indicate that the nicotine gum doesn't taste as bad as people say it does. It's still gum, and it comes in 4 different flavors. You can have the original, the mint, the orange,
Mhm.
or the fresh mint. So
Okay.
normally people can find something that satisfies them and helps them get over their addiction.
Okay.
So if have you understand everything so far?
Yes,
And,
yeah.
You don't have any questions?
Yeah, that sounds good.
If I can show you how to double your success rate of your program, is that something you'd be interested in?
Yes, that's something I would be very interested in.
Because actually, if you look at this graph, people who use the Nicorette gum in as an aid to a program getting off of the nicotine,
Mhm.
it actually doubles their success rate. So we could bring your success rate from 40% up to 80% in less than a month.
Okay.
So
Wow.
I know that you guys really want to help your patients break their addiction. So
Mhm.
That's
Have you heard of this new type of patch that you can just put on your arm?
yes, I have heard of the patch.
I've heard good things about that.
We actually carry a patch also.
Mhm.
But the gum is actually one of our, it's actually, people want it more because it helps with their urges, their impulses, like I said.
Mhm.
You can take the gum, you know, if you're craving a cigarette, you can pop a piece of gum in your mouth and that craving will go away almost instantly.
And how do they compare on price?
On price, the patch is a little bit cheaper, but like I said, it's not as successful in treating the actual nicotine addiction. We actually have two different strengths which differ in price. If patients are smoking over 24 cigarettes a day or one pack, we recommend the 4 milligram strength, and that's actually $55 for a pack of 108 pieces, which will last them to 12 weeks. If patients are smoking less than a pack a day, we'll give them the 2 milligram strength, and that's $45 for the 108 pieces. So over that 12-week program, they will gradually decrease in the Nicorette. So
Okay, and I'm a really busy guy. I don't really want my patients calling me all the time asking how to use this product, so.
I'm
is
glad
it-
you brought that up. Actually, our Nicorette gum comes with a full instruction booklet. So everything that they need is right there. I actually have a sample pack of the gum right here
Okay.
for you. It's small and discreet, so people aren't put on blast when they're pulling out their Nicorette gum
Mhm.
for a piece. And full instructions are included. So we like people to understand the product and know what they're doing. So
Okay,
that's a problem that you won't have.
okay. Yeah, that sounds
So
good to me.
do you understand everything so far? Do you have any questions for me?
How do older patients fare with dentures? That's another question.
Dentures, that's a good question.
Because they can't chew gum?
Yeah, they can't. We actually offer another product for older patients with dentures. It's the patch, but it comes with, it's released at, instead of releasing the nicotine gradually over time, it's released at certain points during the day to mimic the act of smoking a cigarette. You put it on and it'll release some early in the morning, and then normally people will get to their next cigarette at midday, it'll release more, so it'll gradually release as the day goes along.
Okay.
So, and we actually have some numbers. A lot of our older patients trying to get over their addiction have liked that product, and they say it's been very helpful in them getting over their addiction.
Okay.
So, is there any other questions that you have for me about the product? Or?
No, that's it for me.
So, do you see anything standing in the way of our partnership, or?
No, I'm just, a little worried about if it will have any negative impact on our counseling revenues.
Counseling.
Because that's the main thing we do, counseling our patients.
Right.
So I don't want it to, take away from the revenues we get from that.
We actually recommend that, along with the Nicorette gum, patients use a counseling program
Mhm.
because, as I said, separately they have their own success rates. Together, their success rates are much higher. So we recommend our patients to do both.
Okay, well, yeah, that all sounds good to me.
What I want to do today is I want to give you a few, trial samples
Mhm.
that you can give to a few of your patients, and that's how a bunch of our clinics have started, and they've seen that it's actually been really successful and it's helped their patients, and it's helped continue our partnership with them. And then, depending on your experience with it, how successful it is with you. Possibly I can count on your recommendation of our Nicorette gum to your future patients. Is that something sounds okay?
Yeah, that sounds great.
Okay, great. So, do you want to start with the trial gum now, or?
Sure. Yeah, I can start. I want to start off with just one patient. I can
Okay.
recommend it to one patient as a trial.
Okay. Okay. Well, I can get
Just
that
start
for
off.
you right away. I can actually come back this week if
Okay.
you want to do it soon, or next week, or later.
Yeah,
or-
well, I'm open, so
You're open. Okay, I can come back tomorrow actually if that's something that sounds okay.
that sounds okay to me.
Okay, great. Well, then I'll bring the trial with me tomorrow, and we can go from there. Does
Okay.
that sound okay?
That sounds good.
All right, great. Thanks.
All right, no problem. Thank
Appreciate
you.
it.